This is truly one of the most fascinating cases imaginable. In June of 1985, I was retained by a woman who claimed that her granddaughter had not been cared for appropriately at Albany Medical Center Hospital. In this particular case, the grandmother of the 4-month-old infant related that her daughter had brought the baby to Albany Medical Center Hospital emergency room 4 times. And 4 times the emergency room doctors sent the infant home. 4-month-old Jamia was running a fever, not acting right, and to her mother, clearly ill. And 4 times the ER doctors at Albany Medical Center sent the child home. Finally, the child was admitted on her 5th visit and ultimately diagnosed with tuberculous meningitis. Unfortunately, the diagnosis came too late. While the child's life was saved, she became irreversibly brain damaged from the infection. Once admitted, the child was under the care of Dr. Martha Lipo, a nationally known doctor in the field of pediatric infectious disease. Dr. Lipo did everything right, but systemic failures in the hospital led to the child's delayed diagnosis. The child's grandmother retained me, and I received copies of the child's medical records, but I never trust photocopies. So I went to the hospital and managed to obtain originals, which I subjected to microphotography. When I did that, I saw something shocking. During one of the first 4 visits, the word meningitis had been written and then erased. It soon became clear that Dr. Lipo had done everything she could, but the hospital had let her down, as well as poor little Jamia. Tuberculous meningitis, TB meningitis, begins in the lungs, spreads through the spine and into the brain, where it begins to destroy brain tissue. Dr. Lipo had ordered chest x-rays, which were done and unfortunately misread. She had ordered also AFB smears, which is a test of the spinal fluid. These 2 things are standard procedure when it comes to testing for tuberculous meningitis. The x-rays clearly show the TB, which is commonly seen when it's in the lungs. And somehow this information, the correct information, did not reach Dr. Lipo in a timely manner. Another failure was revealed when we cross-examined Dr. Lipo. While she was testifying, she was asked to show me where the AFB smears had been ordered. She pointed to that. I asked her where the results were, and when I asked her that, she said, well, the results are not on the records. In fact, it turns out the test had never been done at all. It's important to note that no doctor or staff member, including Dr. Lipo, was named by us as a defendant in this case. We felt the failure was more systemic, and the doctors had done the best they could under the circumstances. Among the experts we brought was a pediatric developmental specialist. In order to assure that the award would be sufficient to cover the child's needs for the rest of her life, we needed to prove that the child was mobile, that despite her condition, she could live a long life. Our expert lay down on the floor of the courtroom on his side and scooted around the courtroom at high speed. He said, I've tested this child, and she can do that, which means she's mobile, and because she's mobile, she can avoid skin breakdown and avoid respiratory difficulty if her family receives an adequate award to make sure that all this is done for her and with her. And she did get an adequate award. The family received a substantial award. Today, at age 35, our client enjoys a measure of independence in a special home designed for her needs, something that simply would not have been possible without the settlement. The Albany Times-Union newspaper said that the settlement, which was sealed by the judge, was $6 million. It was more.